Minister, as you're aware, the GP sector is in crisis. GPs have faced repeated cuts. There is an almost complete breakdown in relationships between GPs and the HSE, and there are massive recruitment and retention problems. Some estimates are that 7 in 10 GP surgeries are no longer taking in new patients. One of the keys to rebuilding the GP sector is a new GP contract. Sadly, one of the organisations that is key to this, the National Association of General Practitioners, which represents about 2,000 GPs around the country, has been left out in the cold in spite of repeated letters to yourself, to the Taoiseach, to the Assistant Secretary in the department. They have not been able to get any meaningful interaction, and they certainly have not been allowed to come to the table to join the negotiations which, as you and I know, the IMO are involved in. Can I ask you why the NAGP has been left out in the cold on these critical negotiations, and what the government's plan is to do to bring them inside so they can be part of negotiating a GP contract fit for the future? Thank you.
2 minutes, Minister.
Well, thanks very much, Lieutenant Gordon, and thank you, Deputy Donnelly, for the question. And of course, the Deputy is right to highlight the fact that there are a number of challenges facing general practice that we need to work with, including the resourcing of general practice and, most importantly, ensuring that general practice is well positioned to serve the communities now and into the future in line with the Sláinte Care report. It is important also to acknowledge the factual situation that the number of general practitioners on the specialist register in this country continues to increase. There were 2,270 GPs on the specialist register in 2010. There's 3,668 on the specialist register as of the 18th of May 2008. And the number of GPs contracted by the HSE under the GMS scheme has risen from 2,098 in 2008 to 2,497 as of the 1st of June of this year. So the number of GPs providing GMS contracts has increased, the number of GPs registered in the specialist register has increased, but absolutely there are challenges as we have an ageing and growing population and more chronic diseases that need to be managed in our community. I don't dispute that in any manner or means. General practice is one of the cornerstones of our health service, and the government is committed to engaging with the representatives of general practitioners on the development of a package of measures and reforms to modernise the 1989 GMS contract. Our goal is to develop a contractual framework that has a population health focus, particularly dealing with things like chronic disease, structured care for that in the community, and up-to-date provisions on service quality standards, performance and accountability. Officials from my department and the HSE met with the Irish Medical Organisation at the beginning of May to set out the state's opening negotiating position. The department subsequently wrote to the IMO setting out these proposals formally. In line with the long-established industrial relations approach to such processes and the agreement with the parties concerned, I am not in a position to give further detail whilst this engagement is underway. That is normal during a negotiation. But I do acknowledge that the National Association of General Practitioners is also anxious to be involved in discussions about reform of the GMS contract. I have already indicated my willingness to consult with them formally on the many issues facing general practice, and I anticipate that arrangements in this regard will be made in the coming weeks. And in fact, my department has written to the NAGP in this regard, pointing out that we would commence discussions and negotiations with the Irish Medical Organisation. They are a member of ICTU. That's how the state does its business in relation to a lot of our contractual issues, but that we would also provide the NAGP with an opportunity to meaningfully contribute to that. That will happen in the coming weeks, and I'd already put that in writing to them. I look forward to positive and productive engagement with all parties concerned, and the delivery of these new measures for general practice is an absolute priority for government.
Thank you. 1 minute. Whilst I accept you are speaking in good faith, I've seen all the correspondence from your department to the NAGP, and none of the correspondence that I've seen gives any dates whatsoever. I'm going to read you out the timeline. On the 13th of March, the NAGP wrote to you seeking a meeting on the referendum and the 8th Amendment. They were very concerned about talks of a GP-led service when the GPs were not being consulted. On that, there was no response from government to that letter. On the 23rd of April, the NAGP wrote to your Assistant Secretary seeking a meeting to discuss the various issues raised. They had no response from government to that letter. On the 21st of May, the NAGP wrote again to the Assistant Secretary, copying the Taoiseach and yourself. The NAGP expressed disappointment at any lack of response from government on any of the issues raised. The NAGP again requested a timeline for engagement on FEMPI and the new contract, citing talks that the IMO have already started the negotiations, and indeed quoting to you in the letter your own commitment. They got no response from government. On the 31st of May, the NAGP wrote again to the Assistant Secretary, including the previous letters, citing any lack of response, and they raised 4 issues, Minister: FEMPI, the new GP contract, cervical check, they were very concerned they weren't getting the information they needed, and implementation of the referendum outcome. As of the 24th of June, they had no response from government to that. They have had one letter from government saying that at some point in the future government will engage with them. Now, do you believe, Minister, that it is reasonable for an association that represents over 2,000 GPs that you have committed to engaging with, do you believe that is an adequate response from government to date?
Minister.
Yeah, I believe we're carrying out the absolute correct sequence in relation to how to bring about a new GP contract. And I think it's the position of your own party too, I think it's the position of all parties in this House, that the Irish Congress of Trade Unions holds a very crucial role in relation to how we do our business in relation to industrial relations. The Irish Medical Organisation is a member of ICTU. The Irish Medical Organisation is the body that we, successive governments, including governments your own party has led, have engaged with in terms of delivering issues for general practice and indeed for our health service at large. The NAGP, I believe, has a very constructive role to play. I believe they have some very good ideas in terms of how we reform and improve our health service, and I want to engage with them in that regard. I would point out that in doing so, I'll be the first Minister for Health to actually have engaged with them and to bring them into a process. But I do have to respect the structures in which we operate and the agreements that we have in terms of how these processes are carried out with the Irish Medical Organisation. It is, remember, FEMPI and these issues were negotiated while you were in government, or your party was, and my party was in government, through the ICTU structures, through engagement with the Congress of Trade Unions. So it's appropriate that I begin the conversation with the IMO. The NAGP will have a role to play. But on the issue of the 8th Amendment, I do have to say, and I fundamentally disagree with the approach being adopted by members of the NAGP in this regard in terms of the sequence. We would agree the clinical guidelines first with the medical colleges, which includes the Irish College of General Practitioners, and then we will absolutely engage about how we resource it. But we'll get the clinical guidelines right, and I don't wish to see, and you're certainly not doing this, but the issues being conflated around implementing the mandate of the Irish people in the referendum with issues regarding FEMPI and the future general practice. And I would say, and I want to thank the NAGP for the constructive role they played in relation to cervical check. Their president actually did an excellent job in putting out very important information about the screening programme. So the NAGP have a role to play. We will engage with them in the coming weeks.
Final question, 1 minute.
Look, at the 8th, you're right, it is a separate issue, but I was very concerned to see the NAGP waking up, hearing government ministers talk about a GP-led service when they, as representatives of a lot of the GPs, had not been consulted. Similarly, they wrote to you and to your government on cervical check and said, you are saying that GPs are going to play this big role in supporting these women, but we can't get any information from you. When they can't get responses to letters like that from government, you have to be worried. But, Minister, back to the negotiation and the GP contract, which is what this question is about. In August 2016, you said the following, quote, I think it is absolutely essential that we have the new contract negotiated, and I want to see the NAGP as part of that. What I am doing is saying very clearly that when we get down to negotiating the GP contract, which I expect to happen by the end of the year, by the end of 2016, that the NAGP need to be in the room. 2 years on from that, the negotiations on the GP contract have started. They started months ago. The NAGP, on the back of your promise, have written to you again and again and again and again and again, and they can't even get a letter in response saying when you expect them to be in the room. My question to you is, do you think that is sufficient? Or do you think maybe your department, in this case, and indeed yourself, Minister, have fallen short of the standards required, have fallen short of the level of engagement that is required? And will you now step up and give the NAGP a clear timeline for when they can negotiate as well? Thank you.
Minister, 1 minute.
Yeah, look, whilst it's taken me longer to negotiate a new GP contract than I would have liked, I would point out that we are talking about a contract that's been in place since 1989, and we are going to deliver significant reforms to general practice. And Dr Harty, been a strong advocate for this for a long number of years as well. No, I believe the sequence we're following is correct, and I really do. And I think for any different sequence to be put in place would be a significant cause of concern to organisations like the Irish Medical Organisation, and possibly by extension to the broader industrial relations mechanism that we have in this country. We negotiate with the Irish Medical Organisation, but I did say, and I stand by the fact that we do need to have an inclusive process that enables other organisations to put forward their ideas. And by the way, I believe the NAGP have some very good ideas. So the NAGP will be consulted. They will be formally consulted. They did get correspondence to that effect. I've certainly had a number of conversations with leadership figures within the NAGP, as I do with all stakeholders across the health service. They will hear about their opportunity to contribute to that process in the coming weeks, and I want to assure them of that. My priority has been, firstly, deciding the state's position for these contract negotiations. Secondly, getting that position endorsed by the whole of government, because it's no point in just being the Minister for Health's position. You need obviously the buy-in from the Department of Public Expenditure and Reform, which I now have. Then having an initial discussion where we present the state's position to the IMO, which we've now done, and then providing an opportunity for other stakeholders, including the NAGP, to contribute. Thank you.
Right. Move